In the wells? Yeah. Okay.
Like, oh, I got a card like that.
That's a pure.
Yeah. It's over the top of that.
Do we have any? Hello. Okay, good evening, everyone. We find a nice spot. Okay, good evening, everyone. My name is Radhika Jha, and I am Associate Dean, Graduate Programs in Collins College of Professional Studies, St. John's University. And today, this event is a unique event. We are doing a collaboration with HIMSS. I don't know if HIMSS representative Michael is here. No? Okay. Okay, on behalf of HIMSS as well as St. John's University, I want to welcome you. It is a great pleasure and honor to have you all here this evening. And this event, I want to give you a little context for this event. So St. John's University is a partner with HIMSS organization since a long time. We do things together, and then we thought of doing a joint event together where we wanted to bring academia and industry, a kind of mixing of industry and academia. And this is really important because the topic which we are delving in, healthcare, it is the whole world of healthcare is evolving at an unprecedented pace. And I don't know much about healthcare, that's not my field, but I do know that all these, personalizations and AI and streamlining of operations, all these things are happening at such a huge rate, and it's bringing a lot of changes. But, with all these, so we wanted to discuss today kind of a unique convergence between industry and academia and discuss the future of healthcare and innovations in healthcare, especially with AI and digitalization, and how AI and digitalization is at the heart of the transformation and how it's impacting. Definitely, many good things are happening, but also with all these great opportunities comes challenges. Especially with all this AI, challenges of ethics, challenges of security, challenges of equity, and all those things. So I feel this is a great opportunity to discuss all these fine solutions, hear from experts, and that's why we wanted to provide a unique platform where we can have this dialogue, right? And we have distinguished panelists here. They are all experts, at the forefront of this, research, forefront of in the industry. And I'm really hoping that these discussions will be really good, enlightening, and it's going to be an insightful night, an exciting night. We are also using this opportunity to showcase our programs at St. John's University, Collins College. We are a professional school. So Collins College of Professional Studies we offer like specialized programs, and I always tell the students, we have to think about how we can take our education and our career to the next level. And I feel this particular opportunity, this event, is an opportunity for our students as well as all those who are in the healthcare field to take their whatever educational level or their career to the next level, hearing from the experts, knowing what's going on in the field. So I'm really, really hopeful that this is going to be useful for you all. Also, if anybody is interested to know more about our programs, we have our chair of our computer science division, Dr. DeBello. We have our program director for healthcare informatics. So before we start the panel discussion, I'm going to ask Dr. DeBello to talk a little bit about our programs, just in case if you're interested to know more about the education advancement and things like those. But yeah, I'm excited about the panel discussion after that. And Joan, off to you to talk a little about the graduate programs.
You can take this. I don't think I need it. Can you hear me without the mic?
No, but I think so.
Online. All right. So thank you, Dean Jha, for introducing myself. I also want to point out we have one of our career advisors here today too, Elisa. So she's always looking for connections for anyone in the industry who might want to talk with her for our students. That would be fantastic as well. So we have an undergraduate program in healthcare informatics, and we also have a master's program in healthcare informatics. And our master's program in healthcare informatics is fully online, so you can take it from anywhere. So some people here from Texas, there are people from all over world that can take our program. And we have Dr. Bukhari, who is with us right now. He is our director for both our undergraduate and our master's program in healthcare informatics. And he's one of the top researchers in the healthcare informatics and artificial intelligence area. So I'm really looking forward to hearing what he has to say, along with the rest of our panelists here tonight. But our curriculum in healthcare informatics has a program that was designed to have both computer science, healthcare informatics, and technology. So you can also take data science program as well and take courses within the healthcare informatics, which is how a lot of students take our courses, and also computer science and take some healthcare informatics classes as well. And we also have a cybersecurity program, and you can also, again, take healthcare informatics classes. And that's a very interesting area because with healthcare informatics, healthcare industry, and cybersecurity, there's a lot of stuff that we can talk about that needs health security and healthcare combined. And unfortunately, our other chair, the other Joan, because the two chairs are Jones, Joan Tropnis, couldn't make it tonight. And she is chair of the Health Administration's, I forget how you say that division. Health Systems, yeah. Health Systems Division. And they have a number of programs as well. So, we might be able to give you her information later on if somebody wants to learn more about the programs in that area. But I'm here, so after the wonderful talk, if you want to hear anything more about our program, and we're currently working on a 15% discount for the HIMSS members, so for our master's program. So I just wanted to let you all know about that. Thank you so much. I wanted to also say thank you to Justin and Radhika for putting this event together, along with the HIMSS members, Tony and whoever else was helping out. And thank you to all of our speakers. Thank you.
Justin, I take the microphone for later. I just wanted to add before I give the floor to the moderator and to these great people. So as Dr. DeBello said, we are working on with HIMSS. We are working on a 15% discount for HIMSS members to pursue any any education or any workshop or anything related to that. There's something which we are also launching, micro-credentials in healthcare, AI in healthcare, certificate program, micro-credentials in AI leadership, in healthcare leadership, in informatics. So all the different skill-based micro-credentials. So those are also something which you or anybody in your organization is interested in. Just let us know, and we would be most happy to give more information on that. So, and that also, anything with HIMSS, we are working to provide 15% discount to the HIMSS members. So more information, we also have an admissions table outside along with other sponsor tables. So you can grab a brochure or anything from outside there. So I know I'm between these great people and you. So I'm going to give the mic to our moderator, Justin. And Justin, you want to introduce yourself?
Sure. Hi, everyone. I'm Dean Goldberg. I'm the Graduate Assistant Dean. I am so excited and honored to be here. You know, with these events, we understand that students, you know, they need to do academically well, but we also know that they need opportunities to speak to professionals because most of the time they apply to positions and don't have a networking skill. So in all of our program events, we make sure that we have a networking component, right? So if there's something that, you know, one of our speakers says that, you know, really tugs at your heart, or you have more of an interest and you want to learn more about it, you know, definitely ask that, because these are the opportunities to have these professional development opportunities. And I could not be in my role without the importance of networking. So it feels really important to us to mention that. We also want you to come to these events to know that you're going to be learning as well. We don't want it to just be like we're throwing information at you and listen to our PowerPoint presentation. We want it to be more interactive and more engaging. We want you to know, like, I can't miss this because I know that there's going to be a nugget of, you know, truth and information that I can grab onto. So without further ado, we're very excited to have you, and we hope that you enjoy our experience tonight. Thank you for coming. All right, so before we start this moderating panel, I want you to know that we're going to leave 10 minutes for the audience for the Q&A. We're going to also have networking, so there's plenty of time to talk as well. So before we get into the meat and potatoes of this program, we're going to let every panelist give an introduction. So let's start that.
Sure. Hey, good evening, everybody. Tom Bianculli, Chief Technology Officer at Zebra Technologies. And thanks very much, Dean Goldberg, for hosting us, and for St. John's for facilitating this event. Just a little quick word about Zebra. We'll talk more about some of the details as we get into some of the questions, right? But at Zebra, we're really focused on enabling every asset and worker on the edge, as we say it, to be visible, connected, and optimally utilized. So what we mean by that is, you know, whether it's a retail worker that's assisting you in an aisle at a Home Depot, or it's actually medication administration bedside by a clinician, we make the technology that allows that mobility to occur. So handheld devices, the asset visibility that enables you to know where the right assets are, where the right patients are, where the right medication is, and basically fuse that all together to optimize and orchestrate workflows, which was mentioned a little bit earlier. So I'm really excited to be here, and look forward to the chat.
Hi, everybody. I want to thank St. John's for having us today. Of course, for all of you guys from out in the cold. My name is Chris Whiteside. I work for a company called Astound. We're a fiber provider. So unlike my peer here, we do a lot of the plumbing between the hospitals and the schools and locations. So everything behind the scenes. I specialize in healthcare and higher education. So a lot of my clients are, you know, the St. John's of the world, the NYUs, some of the hospital systems that are out there as well. And yeah, we'll talk a little bit more about what we're seeing in the healthcare space as it relates to technology.
All right. Hello, everyone. I'm Jamie Fox. I work for a small startup out of Redmond, Washington called Microsoft. You might have heard of. Yeah. Everyone knows Microsoft, big technology company, big software company, cloud, office. You know, we're very, very invested in healthcare. I am a director of technology strategy within healthcare. It's part of our sales organization, so I visit customers, you know, all day long, talk to customers and see what's happening around the healthcare industry here to share. And even more importantly, close to my heart, I have a senior in high school who's very interested in data science, so I'm a prospect here tonight as well.
Good evening, good to see you all. My name is Aman Bakai, and I'm associate professor and director of healthcare informatics. So I just want, as everyone speak about the company, so I have our department, which is the Division of Computer Science, especially the healthcare informatics. So I would say like what distinguishes like our healthcare informatics program from others. Like we are healthcare informatics hosted in computer science department. So it's very tacky. It's like a true informatics program. that we are really proud of. And on the research side, I work in working for a number of years on clinical and sports systems, and also work the artificial intelligence system. And I think in the discussion we'll discuss more. Thank you.
Can you hear me? Okay, awesome. Just keep the microphone there. All right, so we're going to start with the questions. Anyone can answer, and there's more than one microphone, so don't feel like you have to keep grabbing the same one. All right, so what are the latest technologies we're observing with your customers?
Yeah, I mean, I can start off. I was mentioning earlier, a lot of the vantage point that Zebra comes from is in the frontline work, so enabling mobility, clinical mobility. Rather than just start with the technology, start with the problems, because a lot of times, technology becomes the solution search to the problem. A lot of the problems we're seeing have to do with just returning time to the nurse or the clinician. And some of the studies out there have demonstrated that on the order of 35% of a nurse's time is spent doing things other than providing care, documenting care, doing handoffs between shifts, shuttling back and forth between a nurse station to be able to enter information to an EMR instead of being able to do that, patient side and at the bed. Other statistics out there, during the course of a shift, a nurse will typically implement 21 workarounds. So you're talking 20 plus times they're trying to figure out, hey, how to just work around the system that I have to deal with. They spend about 20, 25 minutes at a time during a shift trying to find things. And that's not what actually some people in this room go to school for. And that's certainly not what nurses that are practicing and clinicians that are practicing, aspire to do when they started their career. So from a technology perspective, anything that helps with, of course, elimination of errors, but helps find those things, helps automatically document, helps identify, locate, and drive clinical mobility. So that's driven a lot of the technology that we see around areas like RFID, real-time location tracking. So this is the ability to actually track assets in real time. It could be an IV pump, could be a crash guard, could be a computer on wheels. Being able to see where that is in the hospital in real time, and then mobilize that information on a handheld device, whether it's a tablet or a smaller form factor, that caregiver could use to facilitate their job and not be looking for those things. More recently, obviously, using generative AI to do things like summarization, language translation, and ambient computing is very, very much associated with that as well. This is the idea of computing that sort of, at your permission, listening in or watching in on what's happening. And so you can think about that care documentation I was mentioning. If the AI is able to sort of listen to someone say, hey, this is what's going on, it can not only just capture all that information and automatically inject it in the EMR, including like more short blurbs of information, like collecting vitals and things, but it also summarizes that information that can be used in a shift handoff. So that requires then less time for that to occur. Communication and collaboration is another big area where in many hospitals, there's hundreds, if not 1,000 roles, and coordinating among all those roles is one of the biggest challenges. So being able to do that with more facilitated communication and collaboration. So I may not know that I want to talk to Justin, but I know I want to speak to the pharmacy. And so I can do that by role. And if you're the person on shift, that would be automatically, routed right to you. And then we could be in a conversation and get done what needs to get done. So I would say, from our vantage point, those are a lot of the areas. And then the other one, which we were speaking with actually Dr. Rockman in the audience over here, that we're also seeing is also using AI for image analysis is obviously another really big one that's on people's radar screen, not exactly in our sweet spot, but adjacency to a lot of the things I spoke about. So those are some of those we're seeing.
As a network provider, we see a lot of applications that are putting pressure on the hospital or healthcare network or higher education network. Some of the things that come to mind are remote monitoring, telehealth, as these technologies are enabling people to access healthcare easier, especially in the underserved communities. Hospitals and healthcare organizations are making sure that their networks are prepared for that also. The other is wearable devices, and making sure that they can have access to people's vitals or information. It could be IoT or I over MT, which is Internet over Medical device. And that could be a pacemaker, it could be a blood sugar monitor. These are the things that are connected now to customers' internet or to their network, and making sure it's safe. So cybersecurity is also something that they focus in on. So these are some of the applications that we're seeing that are driving adoption of network, from my perspective.
Obviously, we see a whole gamut of different things, everything that these gentlemen just said. One thing about you said about the nurses, there's a big problem in healthcare called clinician burnout, right? More clinicians these days are spending more time doing administrative tasks than clinical tasks. And like you said, most clinicians went to school to become clinicians, not administrative. So, as you know, Microsoft, as well as these folks, solutions to a lot of AI, a lot of summarization, that's become very big, right? You can just quickly put a whole bunch of notes into an electronic healthcare record, the EHR, have it summarized. And then the other thing that I'm noticing, and you didn't quite touch on this, is, and then code it, right? Because everyone wants to get paid, right? And that becomes a very, very big thing. And I think that's a little bit under the radar, what's called revenue cycle management, right? How do you get paid for healthcare services? And there's this whole, I'll use the word mess, that goes into that, right? And you code, and you have a certain condition that can be coded 4 different ways with 4 different reimbursements, and which one do I use, and make sure that my insurance pays for it. So a lot of that can be solved with a little bit of AI. They know in advance who you are, who your insurance is. So, we're seeing a lot of AI for revenue cycle. We're also seeing AI for imaging, right? Obviously, you can't do, you're not going to have a pathologist look at you're not going to have AI take the job of a pathologist of every case, but, maybe there's a quarter of the cases that a pathologist would look at that are clearly, obviously, not cancer. That's a quarter of a workload that the pathologist just got off. Doesn't have to do, because these were very clearly not, right? The more edge cases, I don't know if I would trust a computer to tell me if I had cancer or not, but I would trust a computer to say, you look pretty healthy, you probably don't have cancer. So those are some of the things we're seeing also.
Well, thank you for mentioning the revenue cycle. In fact, we are the experts in revenue cycles and working for a number of years, have received a couple of federal grants. So I will elaborate more. So our research and the research said the doctors in their shift, the ER doctors, do 4,000 clicks and spend 2 hours time, 2 to 3 hours time each day. And they have to deal with the software, with the machines. They are not trained for. They are trained for to treat the people, right? So the physician burnout rate, around 70% of the doctors, they have this type of the symptoms of the burnout type of thing. Cognitive load, they have, instead of focusing on the kind of the treatment, instead of looking for the better therapeutic type of the solutions, they have to, it's part of their duty to spend time on that to document the things. So they're saying, if you do not document the thing, you will not get reimbursed, right? So that is challenging, and but with the technology, the beauty of technology is especially the AI, we can automate the things which are kind of repetitive in the nature, just taking notes and extracting that what we are working on. We are taking we developed our methods and systems which automatically connects with the systems like the Epic, with the Cerner MedTech, and through the Smart and Fire API, and it takes the patient data and extract the ICD and CPT codes. And then you see, as the panel were mentioning, there are over 100 different types of insurances. It's a mess. You have to not only accept the code, you have to look for local coverage determination, national coverage determinations, also the type of bundling. And this consumes a lot of time, and doctors have to be involved over there, in terms of, for example, from the pre-authorizations to if anything with the denial handles. So, they cannot be out of this, although it's not, again, it's not the primary job of the physicians, the providers, but they will somehow drag into this type of thing. And with the technology and the solutions that are evolving, that we can definitely, ease their their cognitive load burdens and give them more free time so that they can spend more time on the things they are trained for.
I was actually going to say that you talked about the reimbursements. Every state has different policies also. So even if you're really good here in New York, you want to go to a doctor in New Jersey, well, guess what? Right? You might have to have a completely different code and a different profile in your electronic healthcare record so you can get paid if you just want to cross the river and get care, or you're on vacation. So I think, I always think that revenue cycle is so, everyone thinks of healthcare, how do we fix a human need and what can we probe into you and do all that fun stuff. But I think revenue cycle is so important and doesn't get as much attention sometimes.
Exactly.
You guys are keeping the microphones. There's two down there, so you both can have fun down there. All right, so let's go back to a question I really like, because again, we want to talk about, from a student's point of view, how this panel can help us. So what are some skills and knowledge that young professionals need to keep up with the trends in gain employment? Because I'm sure that there's tons of competition, and I'm sure that there's tons of positions out there, but I also know that you need to have, X, Y, and Z to set yourself apart in the competition. So what would be some skills and knowledge that might help young professionals?
I can start. So, especially if you look like the healthcare domain is evolving, and it's evolving so rapidly, right? So I would say both the hard skills and the soft skills. In the hard skills, as data is everywhere, so you cannot just get rid of this data can go away from this kind of the rapid happenings. So you have to face and you have to prepare yourself and make yourself market ready. And for the skills, just the basic AI skills, analytics skills are very, very important, right? At this time, there are, I think the half of the people are here, they have the what is smart, what is continuously generating data. We have the continuously glucose monitoring type of things, and everything is now integrating, although we have this issue. But I mean, the skills which are hard skills, AI skills, and also the knowledge about the health overall the workflow knowledge that is very, very important. And that's why the health, the people, when we are here in our open houses, people ask what is the healthcare informatics like? What the issue is that if a computer scientist people just graduate there and they just directly go into the softwares or anywhere where they are, they understand, they're expert in their kind of the computers and programs. They absolutely have no clue about the data. The semantics are completely, that's a completely different world. It's alien to them. And same the other way around. If you have the doctors, I mean, for them, if you just talk about the bias and variance and all those things, so I mean, they just, I mean, it's very, very hard for them to digest. So we need to start type of the programs just like the healthcare informatics we have, which can provide them not only the kind of the technical side, but also introduce them with the hardcore skills about this. And secondly, I would say the most important thing is the ability to critical thinking and problem solving. That is very, very important. And that was the motto of our the universities and the programs 30 years ago, and probably that would be after 30 years, the problem solving. Now, as the this GPT things and things are happening, so everyone can somehow develop and produce some type of things. But innovations, the idea that how to solve the things, that is I think so. That is the skill which is attainable, that is practicable, and that we need to teach, and that the students, I think, they should particularly pay attention to.
I like those answers, but my follow-up question would be, since AI is such a huge part of our our landscape nowadays, how can students compete with AI? How can they set themselves apart from AI, what AI can offer?
So the first thing is just to embrace this, right? So learn this technology. right? So the biggest, that is the, at this time, if you look in the healthcare industry overall, the reasons like we have the biggest issue of the adoptions of the healthcare systems. Because like we have a resistance from the doctor side, from the provider side, because they don't know the system, they have the unknown fear. Same as like, you know, we to compete with the AI, better to use AI, understand the AI, and you know, they grow with AI.
So we have a saying, you're not going to be replaced by AI, you're going to be replaced by someone who knows AI, right? That's the skill that people want right now. And I think, you know, if I had to do it all again, and I was a graduating college senior now, I would definitely be a data scientist. That wasn't around 30 years ago when I went to college. And, you know, to your point, there's data, and then there's domain, right? Domain is healthcare. And I mean, we're here to talk about healthcare, but you can do any kind of data, right? Anything can be modeled. I don't know if anyone's ever heard what's called Moore's Law, which is the amount of data in the world doubles every 18 months. So think about how fast that is. And you talked about some of the wearables. My customer actually has implantables. They actually have a smart knee when they replace the knee. There's an IoT sensor in your knee that actually measures your stride. So as you're doing your recovery, right, it can tell you exactly how you're recovering. But it's your iPhone, which obviously has a whole profile of health. And then that goes back to your doctor and whoever else you want that to. So the amount of data is, you know, obviously becoming bigger and bigger, and we have more and more advanced AI. So I think anything data related, and like I said, the domain is so broad, whether it's healthcare or another industry, or even within healthcare, there's so much to do. And then even data science, there's two elements to it, right? One is the data, and I'm going to be a great data scientist, or the other one's the technician, right? The guy who's going with a girl, who's going to program all this. And we still see there's a little bit of a divide. You're either one or the other, or somewhere in the middle. But, you know, even just data science on its own has such a continuum between just pure technology and then the data science side. But I was also going to say there's a second career path overall, and that's cybersecurity. Cybersecurity is super important. The data that hospitals have and the data in healthcare, I was once told that a patient record is worth 10 times more than a social security number on the black market, right? What's a social security number? It's just a number they put in the system. A patient record, that has so much information about you that can be done. That people can do so many nefarious things. They can order drugs, they can impersonate you, they can do so many things. Big deal, they think your social security number doesn't work, I'll find another one, right? So cybersecurity is so important. The other thing is, we see a lot of ransom attacks. Why? Because health systems, you know, don't want their hospital to go down. So they know the cyber criminals, like, those are very, very rich areas for us to attack. And the other thing my mother asked me a few weeks ago was, why do hospitals get attacked more than others? And what I see is because they're under-resourced, right? The banks down on Wall Street, they have all the money in the world to make their environments as safe as possible. Hospitals are not always the, you know, very financially rich. So they're trying to do what they have on shoestring budgets. And as a consequence of that, they are exposed more. So it's an easy target. And, you know, if you're a cyber criminal, hospital goes down, that's pretty bad. And most hospitals you see are paying ransom. They're not figuring out how to beat the rent, you know, how to beat it, or they can't wait. They have patients on tables in the middle of an attack. So I think cybersecurity is going to be something here to stay also. So again, if I was back in my college years, personally, I would do data, but data or cybersecurity, I think you'll be set for the rest of your life, one way or the other.
Yeah, about that cybersecurity, I think that's a great point. I think I read somewhere just this week that healthcare and higher ed pays 40% more in ransom because of cyber attacks. So, and to your point, top talent in cybersecurity or data analytics, they go to the banks, they go where the money is. So it's very hard for healthcare and higher ed to attract that top talent. So yeah, they're a target. One of the things I want to say about AI, you know, competing against AI, and I try to tell my kids this too. I've got a 14 and a 17-year-old, and if we could sit around the dinner table, they like to dive into their phones. They don't collaborate. I think, you know, some of the schools are trying to get that back into the curriculum, making sure the kids are working on projects in labs, collaborating, communicating. So if there's anything that, and I'm sure at, in the high school, I'm sorry, the college level, it's even more so, but if there's a way to ensure that you're taking every opportunity to collaborate with your peers, communicate with your peers and hone that skill, because eventually you're going to be thrust into a team that's going to be attacking a project. You have to talk to a patient, so you'll be leaning on those skills. And then the final thing was just having a firm understanding of technology, because not only is the health sciences, moving at a very fast rate, but the technology that these folks have to use is also moving at a rate. So it's like you have to have skills on both sides to successfully do your job and to have the outcomes that you're looking for. So, making sure that you have a full solid foundation in both areas.
Great, all really great points. I'm actually going to start off with the collaboration one because it was one of my key ones. I think it's totally underestimated. I have 2 kids in college as well, and the range where your kids are, and it's not only is it extraordinarily important, it's not even recognized as being as important as it should be, right? So it's one thing to say, hey, I have a blind spot and something I should improve from a collaboration perspective, but I think it's completely underestimated. So I would put, and I'm just thinking about our own hiring, from a soft skills perspective. Listen, if you're graduating from school in a major and you're in a job interview and you made it to the job interview, what you already made it through kind of what you know. What you're being interviewed on now is how well can you coordinate across teams? How well can you collaborate? How well can you, learn? The examples that were given on generative AI. Do you have intellectual curiosity? Really important. It's one of my interview questions every time is, what's your passion? What gets you out of bed in the morning? What are you excited about? So when you think about what you're pursuing, I would really start with that passion. Like if you could find that, not everybody's fortunate enough to find it. Some people find it earlier in their career, some people find it later. But I identify with that passion because that's what you'll excel at. That's what you'll be excited about. And then I think it might be in my other Microsoft saying actually, but it exists with a lot, which is don't be a know-it-all, be a learn-it-all. Right? So being in the room, and I think sometimes when you're in school or you're competing, that's basically what you're doing. You're vying for position in terms of your GPA, in terms of what rank you are in your class. And so you kind of leave, and I did with the mindset of, I'm competing with everybody that's around me, which is the exact opposite of what you're doing once you get in the workforce. You're on a team on a common mission, and how do you go and deliver on that mission? So that requires, again, sort of that intellectual curiosity and saying, hey, what don't I know? Be comfortable with saying you don't know it, and then surrounding yourself with people that are good at the things you're not good at. The most successful leaders I've seen, as they've kind of made their way through their career, have been the ones that early on recognize what they're really good at and focused on it, recognize what they weren't good at, surround themselves by others that are good at those things. And that takes a certain amount of humility. And it's kind of a weird combination of confidence and humility, right? Because a lot of times you think you have a really confident, you're exuding that confidence, which sort of, pushes humility to the back. But I think leaders at Microsoft, the Satya Nadellas, the Sundar Pichais, those leaders they'll tell you this, they're sort of humility first, servant leadership, and I've always been intellectually curious, and their success as a result of that. So sorry to not focus on so many of the hard things. It's hard skills, but if you do well in school, you've got that. And that when you're at the table, you really want to be understanding how you can put on those soft skills.
And you never apologize for ever saying that, because that was so helpful. Like for me as a professional, I'm embracing not knowing everything is the reason why I'm able to be in this position today. Because when I had this attitude that I knew it all, I knew nothing, and I sabotaged every chance I got. And then when I said, I don't know, please teach me, that was the only doors open for me. So if you take anything away from this discussion, be comfortable not knowing it all, because it is amazing. You will succeed so much more.
One of my things about it's also contagious. So from a cultural perspective, if you're the CEO of a company, you'd much rather have a group of people that have the mindset that they don't know it all, because they're out there, they're collaborative, partnering with other companies and things. So, and I've seen cultures where it's like the culture is everybody should be an expert, and then you end up in this kind of insular mode, and the world's moving way too fast It's an all of the conversation, but the idea of differentiating by having a closed system. There used to be a way we think about like early semiconductor companies or the early days at GE or the early days at IBM. It wasn't about collaborating. It was about, hey, let's make sure we keep what we know inside. That you'll just be left in the dust if you do that, right? So you've got to be much more porous about the way you go.
Yeah, it's really, really helpful. And I'm sure that our students have a lot to hear about not knowing it all. So I think you really helped them to dispel that. Dr. McCarty, what are active research projects you and your team are working on at St. John's?
Well, great question. And thank you for asking. Okay, yeah, let's give you more time to talk about our informatics program. Okay, so we've been federally funded since 2019. And at present, we are working on, as you mentioned, the healthcare revenue cycle. And what we are developing, as mentioned earlier, like the methods and systems. This is very convoluted to me. It seems like, one is healthcare revenue cycle is a big cycle, but specifically we are focusing on the automating the process of medical coding. Like, we develop the system and train our algorithms on that. And first thing is, there are several pieces. Getting the patient data in a way which would be like a secure, avoiding all the data breaches, and then applying the algorithms to extract the information and extracting the ICD and CPT code. Basically, these are the codes, just like you have the text codes. These are the codes for the medical billing. Like, for example, when your doctors have to bill to the insurance, people they come with an injury, they have to code in some E2998, something like so CPT code and CPT code. And then, on top of that, as you mentioned, like, it's the codes are continuously evolving, continuously change every 6 months, every 8 months. Then every state they have different rules, like we have called them compliances issues. Then the issues with with the insurances, some insurances based on your kind of subscription, like they have. So the getting the codes, the billable code is an issue, and the timely reimbursement is a challenge at this time. And that is one of the area in which we are working on. Another interesting problem that we are working on with our College of Pharmacy is the drug repurposing. And so what our students are working on, we have developed a gigantic knowledge graph, a system basically drug genes and disease. And what we are working on is specifically use case of neuroblastoma, which is the cancer common in the kids. And also we are working on the PH, which is the pulmonary arterial hypertension, which is another issue. It's a rare disease, but the why the drug repurposing, it takes like $3 billion to $4 billion from the bench to market, or you can say like developing a drug, getting the approvals from the FDA and all those stuff. We already have a lot of drugs, and these drugs could be repurposed. We see several drugs which could be repurposed like accidentally. We see a couple of examples. Ozempic is one of the examples, right? So the medicines, the chemical, the pharmaceuticals developed for one thing, but later on you found that like this could be reused for the other thing. So what we are working on, we are first, like we have a gigantic kind of the database and the knowledge graph, which is kind of the semantically linked, and on top of that we are developing the algorithms that find the best candidates. And then we test those candidate drugs into our pharmacology labs. And that is the research area in which we are working in. And we have the postdocs, we have the students. Mostly we try to involve our St. John students and give the opportunity to the students, those who are currently enrolled. And all the positions that we have are mostly funded, and we are looking for more people. We try to recruit within the university, and that is the opportunity for upcoming students as well. I mean, we have the projects on our websites, on the GitHub, and the papers around. And do contact me like if you need more information. That's where we are working.
Awesome, thank you. What are the top applications in healthcare? Spy line. You want to go, Jamie?
We kind of talked a bit about that, right? Like, we always think of diagnosis and clinical workloads, right? Whether it's to do some sort of diagnosis of what I have is, whether it's say image recognition, but I kind of talked a lot about revenue cycle management. That's a big one. We kind of talked a lot through a lot of them, but the thing I really appreciate about that is that there's so many different things and there's so many different aspects of healthcare, right? Even manufacturing is part of healthcare at times, right? So I always think, especially if someone's into healthcare or wants to do healthcare, there's such a variety of things you can do. So, what are the applications? It could be clinical, it could be administrative. It could be, you talked even about nurse scheduling. That's a huge problem in their schedule, right? And then you have a nurse who falls out sick last minute, and how do we do that? So just personnel scheduling. A hospital is a fully functioning company. So you have all those other parts to a hospital or a healthcare system that you normally would have in any company. So I almost feel like, I'm not going to say right infinite, but there's so many different areas to focus in healthcare. And, again, bringing it back to a career for younger people, that's like, what are you passionate about? Are you, for me, I'm in healthcare, but yet I can't stand the sight of blood. So that's why I work at Microsoft and not a hospital, right? So obviously I'm not going to do anything that's going to do, be part of true clinical stuff. So I don't know if that exactly answers the question, because we've been talking about that the whole night also, all the different applications. And, again, the big thing I would walk away with, there's so many of them. And here's another interesting thing. What we have here today is not going to be the same 5 years from now. And it wasn't the same 5 years ago. There's so much emerging. And, what did it say? I forgot what the percentage is of healthcare as part of our GDP, right? It's such a big part of the economy. And there's so much opportunity for things like the efficiencies he spoke about. It's going to continue to evolve and evolve very rapidly.
I'll take a stab at this. One of the things that you talked about, what inspires you or passion, and I've done a lot of strategic sales throughout my career. I settled into healthcare and higher ed because I feel like when I can help solve a business problem or an outcome, that's what I enjoy. I don't want to improve someone's bottom line, although that's very important. But it's great if I can help drive an outcome. And so one of the things I want to mention about all these applications and technology in general is helping to close that digital divide, because there is a stark digital divide where these technologies are great if you have access to the technology, but if you don't have access to it, then you run into the same thing that you would have in a socioeconomical instance or geographical instance where you can't get the healthcare that you're looking for. So, these technologies are helping to keep people from having to drive from their home to a hospital, but gives the hospitals an opportunity to take the healthcare and move it closer into these communities. Telehealth is one, of course, we've talked about that. Remote monitoring is another. But through technology, we can have these hospitals now connect to an ambulatory center in a community, an underserved community, an outpatient. We're seeing hospitals move from, hey, I'm a hospital that has a couple of ambulatory, where there are ambulatory organization with a few hospitals sprinkled in. And I think that's helping to drive healthcare deeper into the community and improve outcomes for society overall. So I just want to throw that out there.
I wanted to add something because I have a customer who's doing exactly that. And yes, I'm going to plug Microsoft in the cloud and Azure, right? By putting a lot of these services in the cloud, it makes it more accessible to anyone in the world. So one of my customers does electronic healthcare records with a lot of interesting, AI and services like that. And through the cloud, they're able to serve rural communities, which barely even have a hospital. We take it for granted here in New York City that, if someone faints on the street, you're going to have 18 ambulances and 6 hospitals within like 3 blocks of you, right? But there's places, my customer has hospitals that don't have internet. They're in the middle of nowhere. They're on Indian reservations. So in fact, even upstate New York, I found out, upstate New York, There's parts of upstate New York where there are local hospital systems, the University of Vermont, not even in state. So, we take it for such granted being down here in the city, right? There's a lot of people, there's a lot of places in the world that don't have the access that we so customarily expect and have. So to your point, the access to healthcare is really, the cloud and a lot of these modern technologies make it so easy to access and democratizable to everyone. Has really improved healthcare also.
Yeah, I would just add, great insights into lots of different types of applications that were enumerated. Because there's so many applications, the integration of the applications is a huge opportunity. So one of the things we see from a lot of the hospitals we work with is just room turns and the inefficiency in room turns, or the waiting time in an ER in order to get a bed. And when you peel it back, it's starkly simple. The problem, the patient gets discharged, but they haven't got the paperwork, so they can't leave the room. Then they get the paperwork, they can leave the room, but then, the staff that are to clean the room haven't been notified. And an hour goes by before they get notified. Then they get notified, they clean the room, and then the room actually getting dressed and set up for the next patient doesn't get triggered because, someone only just found out the room had been cleaned. And so there's just all this time that's being lost in that. And so as you start to think about taking the data from all these applications, integrating that together, and you start triggering these automated events, that can really shrink down that time. So there's quite a bit of work going on around that. And I think being able to just stitch together the intelligence across the different applications is a big one. The other one is, there's a lot of thesis out there around generative AI replacing the user interface. And I think that's another thing that we're going to start to see, where instead of, going into an application, to document some care, and then exiting that application, going into a meta application, and then exiting that, and then going into, maybe a contraindicator application to look at interaction of medications and exit. You'll just basically have this interface where you can, or even things like HCM, human capital management, where you want to change, you want to swap a shift, workforce management, labor plan, all of that. You might have to go 5 menus deep into something like that in order to be able to swap your shift. If you just say, we're working on these things right now, where you say to the device, hey, I'd like to swap my shift with, Jim on Tuesday, and it will actually do all that dirty work for you. So it'll go into the APIs and those backend systems. That basically starts to peel away the whole user interface. And then it's sort of like, what's in it? I don't know if this is like an interesting question, but I don't think an app 5 years from now is going to be what we think of as an app now. A lot of the backend enterprise resource planning, EMR systems, and systems of record will all be there, but the way you interact with those is going to get much more automated through agents. And that is both an application comment, but it's also a great opportunity, I think, similar to what's going on with the revenue cycle and innovate is a tremendous opportunity to innovate around that, because those frontline workers want better experience. They want more streamlined experiences. They don't want to be, icon hopping on the device. And if we can enable that, it can be pretty profound.
It also helps the customer service, right? Customer service is increased and everyone's happy and there's no technology problems. I mean, I'll go home, smiling from ear to ear, right? That's the main problem. Technology issue is failing in some capacity.
Yeah, when we were having the conversation on room turns with some of our customers, the digital conversation between all of that data that's helping with the room turn and the family became another dialogue, which is, hey, there's people in the waiting room, there's loved ones that are trying to get informed. Obviously doing that in a way that's compliant, but you've opted in. And now that's the information that could be used operationally is dispatched in a more, patient family manner that's more friendly to them. It's the same information, right? The patient moved from this room to that room, they're out of the OR, they're in recovery, and being able to democratize that data. So yeah, you're also then spending less time getting interrupted as a caregiver with those kinds of family questions perhaps as well. So yeah, it's interesting.
That's really helpful. I feel like we're kind of touching on this, but I'm just going to ask this my last question part 2. So where do you see the biggest holds up in technology in healthcare, and where do you feel like technology is going to help healthcare in the future? Now, what is the problem you're seeing, and how do we see that it's evolving and changing over time?
Great question. So, I mean, one thing is like, as we are all discussing, like the evolving nature and fast-paced nature of the technology. And then on top of that, like we issue of some regulatory compliances issue. We issue, for example, like, we have no Gen AI. So the FDA, what's the FDA is working on that? If someone come up with kind of the solutions, like how they will get licensed, right? So the standards and the way of, for example, even with the data integrations and the people's acceptance, the technology is evolving, and the things like so and the way that how we can make them like the legalized or regularized, that are ways to. So that is, I think, one of the hurdle at this time. Yeah.
I think with all the electronic health records that are floating around there, everyone's got a different standard that they're using, a different way of going about it. Interoperability is probably one of the biggest holdups. I think in a perfect world, that central repository where all these documents sit is where we want to be. But today, there's a lot of pushing and pulling, and I think you've got some really smart people collaborating to try to figure out how to solve that. But that's definitely one thing that's kind of holding it up. And then as just a follow-up to that, cybersecurity, you've heard it many times tonight. Healthcare organizations amass a huge amount of data in a very short period of time, and keeping that data safe, building the proper walls around it, making sure it's traversing a network between entities in a safe manner. That's another, something that we have to care for, and also holds up progress because we could probably connect them all together, but can we do it safely?
I was just going to also mention what I said earlier, resourcing, right? Do we have the skill level? Do we have the people? Do we have the finances, right? Again, there's not always the financial resources we need, right? And then you have, so I think that's a big hold up sometimes. I also think something you said is, just general technical adoption, and me probably see this a lot more than anyone else, is there's, the whole digital divide by age. The people who are going to med school today who are, born in the 1990s and 2000s, they think of, using a phone like, they expect to be able to move their shift on their phone, right? And, there's still doctors out there. I mean, for anyone who knows about doctors, they still use fax machines, right? We have a problem with that at Microsoft. They're like, how does Windows 11 use a fax? How does Windows 11? We're like, why are you using a fax machine? We're not designing Windows 11 for faxes anymore. And
Or CD-ROMs. That's the other.
yeah, I mean,
That's literally a thing.
so I think the adoption of technology has just been slow because also I think, you have a lot of really smart people from different generations, and when you hate to say it this way, you're just kind of setting your ways a lot, right? So you have a lot of that. So it's been a little bit harder, I think, to get some of the modern technologies in there. So I think the adoption is a big one. And like I said, just sometimes financial resources too. Not every hospital and not every caregiver has a lot of money. I'll give you a quick story on this too. You go to a doctor's office, especially a small doctor's office, they buy their hardware at Costco, right? Because it comes out of the doctor's pocket. I actually had to go to a seminar from one of my customers where they had to explain to their customers, don't buy your computers at Costco because that's not the right experience you want to run your doctor's office. But, again, small doctor's practices comes out of their pocket. Like, hey, if I could save a few $100s, I'll go to Costco or Best Buy. And so, there are financial constraints sometimes.
Very related to one of the ones you mentioned, Jamie, and you mentioned a couple of times, change management, which is, that's just a huge one. We see it all the time. In fact, when we're doing new things, and kind of we know we're on the bleeding edge, we'll often profile the type of customer we're going to work with based on their innovation culture. So like if they don't have a culture that's leaning into, hey, let me try new things, let me co-innovate with you, we will actually avoid them as someone that will work with on a leading edge area because very often there's this, even if, whether it's, kind of a demographic or it's just, hey, we have an SOP, standard operating procedure. We've been doing it this way for 20 years. Like we just don't want to change. So then you can't get the adoption, even if it's the logical and better thing to do. The other thing I would say, particularly in healthcare, more so than even other verticals, is just incentives. So sometimes the incentives are just, one of the ones that we spoke about earlier, are set up in such a way that what would have the highest return on investment, the highest ROI, if you were in retail or a transportation logistics company, the way that FedEx makes a decision, as an example, is really simple, right? I'm going to spend $10 million on a project and I better make $12 million back in the first 15 months or so. Like I've got to break even within, or in plus in that first 15 months, and then it's kind of gravy after that. Even if you've got that ROI in healthcare, it's not always easy to sell into that ROI because there's so many different stakeholders, different decision makers. And in order to get the ROI, oftentimes, the investment is not necessarily coming out of one pocket, right? It might be coming partly out of operations, partly out of IT, partly out of admissions, and getting, again, it's a cultural thing, getting those different departments to say, for the greater good of the overall hospital, we're going to kind of each give a puzzle piece in order to get the whole picture together. And that's, not easily done. So I'm imagining, Chris's sales cycle is probably something you deal with, which is how do I bring the stakeholders together? Really not just to help you, but to help themselves, because, they're sort of stuck in, not being able to optimize the whole picture. So incentives, I think, is another big one.
I just want to go to my doctor's office and have them hand me a clipboard with 5 pages to fill out every time and every year. So, yeah, when I see that as a technologist, it definitely, I scratch my head going, gosh, where are we? Where are we going? How soon do we get there?
Everything hasn't changed. My home address hasn't changed. Nothing's changed here. I will inform you if something changes. Can we move this along?
We've been working on this side, like the trustworthiness that is we've been exploring from several years now, and the issue, we discussed, this fear, unknown fear, from at this time, especially the pathologists. Pathologists, radiologists, and people, those who are related to the imaging, they are really, they are, frightened. Some people are. AI is so good, so efficient, especially the imaging type of thing at this time. So they feel like they can replace at any time. So the questions from last 2 years through surveys, through interviews that we asked, how we can build the trust among the system. You remember the COVID-19, there are over 7,000 algorithms, they say, in the literature they developed, and none of them deployed at the right time. There are a couple of at the experimental setup, but one of the reasons was not the technology. The reason was the adoptions, the trustworthiness of the thing. How this is very difficult question to address, and the approach that we have adopted at this time, especially the use case that we are doing, is how we can bring the trustworthiness. That is the several ways. So the overall the answers from the collective answer that we got, if you involve people in the process, that bring. For example, we met first time, if I explain the thing, if I involve to the doctors and showing this is how this is the community thinks that, and then it's not completely, make them the lovable or adoptable thing, but still the fear of the things, and that would open up several kind of the doors. And I think the issue at this time, and how this thing will come. This thing will come when you continuously get educated yourself as a caregiver, as doctors, as the providers, as the people in the organizations. If you can, for example, as they give the example of the doctors 40 years old, so the one thing is the attitude. The other thing is do we have the enough type of the infrastructure, the courses designed at their level, at their capacity, so they can understand the uplift their skills. So they have the less fear of the AI, generative AI, and things, so that they will not fear any type of the EHR system, and they will just go over there. So I think the equipping with the new knowledge and embracing the thing that could be a one solution for adopting.
Also, a little bit of our Microsoft philosophy is that AI is a companion. It's not replacing you, like I said earlier. You're not going to be replaced by AI. You'll be replaced by the person who knows how to use AI. And I'm sure everyone's seen the marketing. We have Copilot. It's not Pilot. It's co-pilot, right? So we really feel that AI is a great companion technology, but to your point, if you can easily rule out a whole bunch of use cases for like a pathologist that are obvious, that's fine, that's. But I would not want to be the first patient that you were diagnosed with cancer without a human being verifying that data, right? Same thing, you wouldn't want an autonomous airplane, right? That would be AI, right? There's some human elements when it really, really comes down to it. But AI can make things better, it can make things easier, right? And again, it's a companion technology, it's not the replacement technology.
Thank you. So we are going to wrap up. However, we did want to have a Q&A. If you're sitting here and have questions and you want to ask something, I'll give you the microphone.
Thank you. It's a question that is also a statement. We have access now to a huge database in medicine. So the data science is a huge opportunity. What I think that instead of starting to go into the diagnostic side, we will do much better if we go into the screening side and predict which patients are going to go into the hospital compared to having a patient with a mass, with a pathological biochemical test, and then, what is the disease? And something about the algorithm, data science I wanted to mention. It's not a scientific algorithm. I'm talking about a clinically actionable algorithm, which means it works in patients and it shows a quantitative value that you can say that the healthcare has been improved. So it's not an academic type of project. It's clinically actionable, whatever works.
I just want to comment on that. I don't have an answer because I deal more in network stuff, but I did read something just recently about one of my clients that was looking at, and then in one particular area, they were looking at avoidable diseases. I'm not using the correct term, but diseases that, with the right prevention, you can avoid. And they were mapping these in a geographic area to see who had the highest instances of these avoidable diseases. And it had a lot to do with access to healthcare, because if they didn't have the proper access to the healthcare, you saw these numbers climbing. And so I think that when I heard you speak, that's made me think about that. And I do think that there's an opportunity for people to embrace technology, to really dive into the information, to see where could they apply their efforts. So just a comment, I guess.
I've been working with some of my customers have looked into that, and I'll tell you some of my thoughts. First off, unfortunately, financial, right? If it's 1 in 100 million disease, who's going to invest the time, the resource, right? So my one customer, what they were looking at was diabetes, which is a very common thing, asthma, and opioid addiction. And they were able to, with some data science, do some predictive analysis of saying, based on whatever data science, this is what a profile might look like pre-diabetic. This is what a profile looks like pre-opioid. And they actually did a whole talk about it. They had 5 stages to opioid addiction. And the idea was to catch it in stage 1 and 2, whereas most times it's stage 4, stage 5, where you're far gone. So there are, I think, things happening with that. But I think the biggest challenge is it worth it financially? Who's going to, again, if it's and you're kind of almost allude, like the rare diseases are the ones that scare, I think, everyone. Like, I got something and no one can figure it out. I wish I didn't have this. But they're so rare, it's harder to do, where the more common ones in society.
As heavy, handled, and expensive like diabetes. You go for Parkinson, dementia, Alzheimer, all these problems, and much bigger problems. We go early childhood, and we start to detect dysfunctional intellectual. It's huge, because it's a whole life. The best investment would be the child in the preventive and in the AI, because you can avoid the disease that it's going to go to last for 40 years.
The problem is we got a sick care system. We don't have a payer coverage from birth to death. So nobody will pay. They pay when you get sick. You don't pay for that.
Sure. And I will say this, that can't say this with any certainty, but I know there's a lot of research in a lot of those areas. And it's really coming also down, there's a lot of genomics, right? Can we look at your gene, which now can be sequenced and stored and like, with all this great computing? I think that's, if you ask me, there's gonna be a lot more insights gained at a genomic level. Why do you have this condition or what's happening? And you can actually probably trace that over your lifetime. But you said something very, very key, and I said this at a talk yesterday about healthcare data is inherently biased because healthy people don't get tested all the time, right? So we know what that looks like, but we don't have as great of a baseline because, hey, I'm healthy. I'm not going to go for all this MRIs and all this stuff.
I have a student question.
I'm not a student, but that's okay.
All right.
My name is Mark. I guess maybe my question is, how do you guys define value for a lot of these types of customers, and how do they then take that value and align incentives such that make sales become easier, et cetera? I can kind of reframe that question.
I'm going to talk a little bit about us when I was talking about some of the clinical workflows in the front line. Yeah, it really starts with what is an operational problem that our customers are experiencing, and then that backs into the value chain, right? So if we're saying that use the room terms example, hey, if we deploy this technology that's able to trigger the events autonomously, then we'll increase room turns from X to Y, right? And then very often, there's other folks in the room that are much more familiar with this than I am, but the healthcare system, particularly in the United States, is pretty fractured, right? So you've got, I think it's about 5,000 hospitals. Very often, they're all, all different varying amounts of, budgets, and they're all making decisions aside from some level of collaboration, largely independently. So, as you look at working, I was mentioning earlier, working with the ones that are maybe the most progressive and looking to innovate, you sort of build those out as a lighthouse example, a lighthouse customer, case study that, and that becomes value in and of itself that you can step and repeat, with other customers. We have an entire team inside the organization that does ethnography and basically time and motion studies and looks at ergonomics, and very often they'll go into these environments and just work a shift, shoulder to shoulder with a lot of these types of personas, like, the nurse or the clinician or the physician, and really understand what's happening in that workflow that can be done better. And one last thing I'll close on, particularly as it relates to value nowadays, is worker attrition. Burnout was mentioned earlier, and just worker availability. And healthcare is definitely experiencing that. Maybe one of the places where it's the worst. But if you look at some of the Korn Ferry data that's out there, just given the aging population globally, there's going to be a shortage of about 80 million workers by 2030, which is probably good for all the students graduating because you're going to be in demand. And as a result of that, it's estimated, this is Korn Ferry's number, that there'll be about $8 trillion of unrealized economic output. It's probably the first time in human history where, economic output's gated by, if we have enough people, which is the other accelerator of all this AI and co-pilot, because you don't replace a person, but if you replace 30% of the person's time, then they get 1.3, every three people's functioning is 4. That becomes, really powerful. So that, I think, is another, from a value point of view, everybody's got that on their mind. How do I reduce burnout? How do I reduce attrition? How do I improve how long it takes to become competent if I hire a new person? And how do I get more done with fewer people? Doesn't matter what vertical you're in. We see that across the board.
So it's also that what makes healthcare very unique more in this country is the person that consumes the service, the person that delivers the service, and the person that pays for the service are 3 different things. So value is very contextual, right? So you can go to a great doctor, got great, great value, but then your insurance ain't paying for it. Or, so that's a very, very hard question. And there's a lot of government incentives for funding as well, right? Unfortunately, I think a lot of the incentives comes down to finance, right? And a lot of the value, right? Because again, that's it. Yeah, there's a certain amount of time you're allowed to be in the hospital, right? Maybe you want to be there longer because you think you're going to get healthier, right? But that's not your decision, right? So that's what I mean. Like, value is a very subjective thing based on who you are. And, maybe I go to the doctor and they repair my broken arm in an hour and I'm still in a little bit of pain, but hey, it only costs the insurance company X number of dollars, right? How do you interpret that value, right? You're healthy enough to go back, but you might be a little bit of pain, So I think that's a very, very hard question.
We have time for one more, and then we're going to take this to networking.
Hi, my name is Hazel. Thank you very much for your insights and sharing the information. If I could just share something about the rare diseases. So I'm the person who traveled from Texas for this event, by the way. There is a government entity called RKH, which is around the research of rare diseases. That has actually been anchored in Dallas, and they focus on what was mentioned earlier, along with UT Southwestern Health Foundation as well. Just in terms of actual service provider, and that's so Starlink, I've heard is one of the ones that helps rural health with access or whatever. But my question is, we talk about healthcare, and the gentleman mentioned what I call well care, but we also know the silver tsunami is coming hard and fast for 2050. What have you seen, in terms of maybe any of your, whether it's research or whether it's actually where Microsoft is going with this, quantum computing as well around the network services provider, and then the edge side of it. Big question I have, but it's important.
The silver tsunami coming, as you said, the question is relative to what to do about that, or how to manage it, or what.
Or what you hear about it.
Yeah. I mean, unfortunately, from our perspective, I think some of the statistics I gave before is more on the care side of it. But that, the shortage of workers and the ability to do it, that ratio is definitely a problem, which is why some of these technologies are definitely being accelerated. One thing, if maybe I can connect the dot, and also demonstrate the, don't be an know-it-all, be a learn-it-all. There's a Professor Mark Hurley, who I've been fortunate enough to, know Professor Mark, okay, you do. So a lot of the things we were just talking about, he's at the University of Maynooth, I believe, in Ireland. He's also run the healthcare system in Ireland, and he's the founder of the Digital Health Symposium for the United Nations General Assembly. But you can find him out there. But he's a lot of these principles we're talking about, and he's thinking of that arc. So he has a tremendous amount of information around it. And he talks about migrating from sickness being at the center of healthcare to wellness being at the center of healthcare, which was the conversation we're having, and from doctor knows best to patient knows best, which is maybe blasphemy, right? But the patient, that's really around medical record side of things, which is with all of the privacy laws, like the person that's the most penalized often is like the person that wants to get access to the medical record. So if I want to get my complete medical record history, it's like, a Herculean task to go get it. So how can you mobilize that, make that available? And then from a wellness at the center, it's about baselining. He talks a little bit about kind of quantified self in there as well. Because if you can baseline your current health situation, and then the quantified self concept is where some wearable technologies of the IoT stuff, Chris, like you were mentioning, the cost of like vaccinating someone, you could actually give them a bracelet that could measure enough key information that would indicate when they're deviating from the baseline. And so his vision is you sort of, what Doctor was mentioning around investing when you don't have a problem, when you're younger, and then you're monitoring off that baseline continuously, and then intersecting, whether it's the opioid example you gave, or it could be almost anything, when you start to migrate off that. And I think that, if we're going to handle the tsunami that you were describing, it's detection early, it's move to wellness, it's empower people, and it's, get early intervention, and then, magnify or amplify the workforce through a lot of the different technologies we were talking about. Best I could do, but, you already know Martin Hurley, so, but he's an inspirational person.
Okay, I think it's time. But this was, I really want to thank all our distinguished speakers for this wonderful insight. One thing which I was thinking before I conclude is, I mean, you all mentioned about the different healthcare applications, there's so many innovations, but I also saw you mentioned the resistance and the hesitance from among the healthcare workers and in the society to adopt those. So I think that's a big challenge. That's probably a food for thought for all of us, especially we as educators. We think how we can bridge that gap, how we can bridge the gap between what technology people are doing, bringing in all new innovations, and how we can make people adopt that. So probably we can play a role here as educators in providing training to people and I'm sure companies and the corporates also and the healthcare organizations, they have a huge skill gap. That's what I'm hearing. I was reading that especially in the healthcare field, there is a huge skill gap, and most of the healthcare employers, they want to upskill and reskill the employees so that they can make use of all of these great innovations. So that's a challenge. That's a challenge, but we are here as educators, and we try our best to provide that training and that education so that that can be used, these great innovations can be used. So with that thought in mind, I want to conclude this and thank you so much. Gratitude to our speakers for this insightful evening, and thank you everyone for joining us tonight. There's still more drinks and food there and networking. I think so that's also very important. And if you have more questions, we will have the email of our presenters here, and we can get your questions and get answers to your questions. Because of time constraint, we have to end this right now. But thank you so much, everyone, and we'll see you there in that room. Thank you. Before we just
Yeah.